Okay, today I'm going to be administering medication to my patient. The order is for 1 sub-Q and 2 PO meds. So now I'm just going to pull them from the Pyxis. The first one is hydrocodone bitrate acetaminophen. So this is it, and I'm checking it against the MAR. The second one is omeprazole. So I'm checking it against the MAR. And the sub-Q one is enoxaparin. So again, I'm going to check this against the MAR, and it's correct. So now I'm just going to put the medication, the PO medications, in a little cup for my patient so that it's easy for him to take and easy for me to transport. And now I'm going to draw up the sub-Q medication, enoxaparin. So I'm going to take my alcohol swab, and I'm going to clean the top of the vial. I'm going to take a brand new needle, sub-Q needle, uncap it, and I'm going to aspirate air into the vial. So the order calls for 40 milligrams, and this syringe is in milliliters, so we're going to do 0.04 milliliters. Okay, so I filled the syringe with 0.04 milliliters, and I'm going to aspirate this air into this vial. Okay, so now that we have the correct medication and no air bubbles, I'm going to use the scoop method to recap my needle. And again, I'm going to make sure this is the correct medication for my patient. Enoxaparin sodium, okay. And we needed 0.04 milliliters. And for the hydrocodone and the omeprazole. So now I'm going to go to my patient's room and administer the medication. Hi, my name is Maya, and I'm going to be your student nurse today. Could I have your name and date of birth, please? Okay, I'm going to check that against your wristband. And do you have any allergies? No? Allergies. Okay. All right, so I'm going to provide some privacy here. And I'm going to check your medications against the MAR one last time. So we've got enoxaparin, correct. Omeprazole and hydrocodone, correct. All right, so now I'm just going to perform the 6 rites. So this is the right patient, Mr. Hayes. It's the right time, which is 9 a.m. It's the right dose of all 3 medications. It's the right route of all 3 medications, which is sub-Q and PO. And they're all the right medications. All right, so I'm just going to wash my hands before we begin. And we're going to start with enoxaparin. Is that okay? All right, so enoxaparin is going to be injected into your abdomen. And I'm going to make sure I do it at least 2 inches away from your belly button. All right, so I'm going to grab my alcohol swab here. I'm going to clean your belly. I'm going to hold that there. I'm going to take my needle, uncap it, and I'm going to pinch your belly, and you're going to feel a little prick on 3, okay? 1, 2, 3. All right, I'm going to hold that there. I'm going to put my needle over in the sharps. All right, should be all good. So now we're going to give you these medications by mouth. You have the gold one, which is omeprazole, and you have the red and white one, which is hydrocodone for your pain, okay? All right, so you can go ahead and take those, and I'm going to get you some water. All right, here you go. All right, could you open your mouth for me? Stick out your tongue. Perfect. Okay, do you have any questions for me? Okay, do you have to go to the potty? Are you in any pain? Okay, I'm gonna make sure I put your personal belongings here. None of your pumps are in the way. And do you want to stay in the seated position? Okay, cool. Well, I'm going to clean up and I'll be back to check on you later. So for the last of the 6 rides, I'm going to document. So my patient has the correct medication and the correct dose. I'm just initialing beside each one. And here I'm going to write my name and my title. TW student nurse. Here are my initials.